Let's focus on insomnia, with a lot of symptoms associated with this. Now, here's a list. If you're experiencing any of these, this could be a sign that you have insomnia. When you have people who come into the sleep center, doctor, which ones do you think are the most prevalent?
Well, let's kind of go through these. You know, when we look at symptoms of insomnia, you know, certainly there are a number of disorders, even unrelated to sleep disorders, medical or psychiatric conditions that can actually have symptomatic insomnia. Or alternatively, patients may have what we call an insomnia disorder, again, getting to the, speaking to the issue of some underlying hypervigilance and some a different sort of underlying substrate, as we call it. But you can see here, regardless of the cause, these are the typical symptoms. Yes, people are generally frustrated with their lack of sleep. They tend to get a lot of nocturnal anxiety about the fact that they're not sleeping. Physical aches and pains can be a result of insomnia. And interestingly, I'll talk a little bit more about the bi-directional relationship that actually exists between pain and insomnia. Certainly impaired performance at work because of lack of sleep. Some patients may have some daytime drowsiness, certainly low energy. It's very interesting, though. Patients who have an underlying insomnia disorder, where they're living in that sort of hyper-aroused, hyper-vigilant state, feel quite fatigued during the day. However, if you ask that person to go take a nap, they find it extremely difficult to nap. That's different than somebody with sleep deprivation, because someone who's sleep deprived, if you ask them to take a nap, they'll fall asleep immediately. So that's kind of one way of determining, making that distinction. Difficulty paying attention, of course, anxiety I mentioned, and mood issues.